Welcome to another short from the Vet Med Digest. Rodenticide poisoning presents a constant and complex threat to our pets, ranking second only to insecticides among the most common pesticide exposures in dogs and cats. Historically dominated by anticoagulant rodenticides, the landscape of toxicosis changed significantly following Environmental Protection Agency risk mitigation rules implemented by 2011. These changes restricted potent second-generation anticoagulant rodenticides from consumer products, leading to a rise in exposures involving non-anticoagulants such as bromethylene and cholecalciferol. Anticoagulant rodenticides interfere with the recycling of vitamin K1 in the liver, which is essential for producing functional clotting factors. This disruption leads to a coagulopathy, with clinical signs of bleeding typically appearing 2 to 5 days after ingestion. Classic symptoms include lethargy, difficulty breathing, and hemorrhage. While the prognosis is generally good if treatment is prompt, timely diagnosis is crucial, especially since bleeding episodes can manifest atypically, presenting as neurologic signs due to hemorrhage in the central nervous system. The life-saving antidote is vitamin K1, administered orally, sometimes requiring supplementary plasma transfusions for animals experiencing acute hemorrhage. Notably, certain long-acting anticoagulants can persist in canine feces for periods exceeding 700 days after ingestion. Bromethylene, a neurotoxin whose incidence has increased dramatically, poses a grave threat because there is no specific antidote. It causes cytotoxic edema in the brain by interrupting energy production in the mitochondria. Symptoms are dose-dependent, ranging from rapid convulsant signs like seizures and tremors at high doses, to delayed paralytic signs like ataxia and hind limb paresis at lower doses. Treatment relies heavily on decontamination and managing brain swelling with agents like mannitol. Emerging therapies such as intravenous lipid emulsion have shown promise in reducing the toxic metabolite levels in blood, potentially offering a better prognosis in previously fatal cases. Clinicians must be mindful that repeated doses of activated charcoal carry the risk of inducing severe hypernatremia. Finally, cholecalciferol, or vitamin D3, creates life-threatening hypercalcemia and hyperphosphatemia, leading to soft tissue mineralization and acute kidney failure. Treatment requires aggressive intravenous fluid diuresis, diuretics, and corticosteroids to reduce calcium levels. For severe cases, bisphosphonates such as pamidronate disodium are often employed to inhibit bone resorption and lower calcium concentrations. Accurate identification of the toxic agent remains the cornerstone of effective intervention, due to the wide variation in mechanisms, treatments, and prognosis among these prevalent rodenticides. Thank you for listening. The link for the full podcast is below. Remember to like, share, and subscribe if you enjoy this kind of material. From Vet Med Digest, where we keep minds inspired, hearts light, and tails wagging.